All right, we have Mark Nelson coming to us from Fairview, and Mark is a pharmacist. I don't want to take too much time to introduce you because you know yourself better than I do. So, Mark, thanks for joining us today. This is the Health Career Exploration class at Princeton High School. So, if you could just take a couple seconds and tell us what you do.
Great. Thanks, Eric. Thanks for having me. I am the director of the pharmacy and the respiratory therapy departments for both Fairview Lakes and Fairview Northland, so over at Wyoming and in Princeton. I've been with the organization for 35 years, I guess, and been in pharmacy that entire time. Respiratory is kind of a tag on for me, so I'm not an expert in respiratory care by any means, which would be helpful these days with all the COVID stuff going on, where respiratory care is right in the heart of things. But as far as pharmacy standpoint, I help manage the pharmacies at both of these hospitals. They are inpatient pharmacies, so they deal with patients in the hospital itself and in the emergency room and same-day surgery, those areas. Retail pharmacy is a separate part of our world, and I don't deal directly with the retail side of things, the drugstore side of things. So I'm more focused on the hospitalized patients and on patients that are coming to us in a more acute setting.
Yeah, thanks. Could you, so the first question on my list is pretty much the basic first job interview question. If you could tell us about your educational background, starting kind of in high school, and then your professional experiences leading up to your current position.
Great, yeah. I actually went to high school in Sacred Falls, Wisconsin, and so I'm a Wisconsinite at heart, and actually still live in Wisconsin, or live back there again, so I do commute each day. Yeah, went to high school there, and then went to the University of Wisconsin at Superior for a couple of years, kind of a figuring out what you want to do situation. And one of the things that appealed to me there was the possibility of working in pharmacy. So I transferred from the University of Wisconsin Superior to the University of Minnesota, and got my pharmacy degree at Minnesota many years ago. And then initially, I'd always kind of thought in the back of my mind that I wanted to work in a drugstore, that I wanted to be a retail pharmacist, as that's what I was familiar with, and didn't really know much about hospitals and hospital pharmacy at all. Didn't know there was such a thing, actually. But during school, they have the opportunity to rotate through different sites. And one of the sites I had was a place called Midway Hospital in St. Paul, which is not a hospital anymore. But gave me the opportunity to work with a really great bunch of people that introduced me to hospital pharmacy, that told me about that part of the world. And I was really intrigued the first day I stepped in the door, and have spent most of my career in hospital pharmacy. I did work in retail pharmacy for 1 year, year and a half, some years ago, and found out that the hospital was my home. That's what I like to work with. So have been in that role since. I worked as a staff pharmacist for about 7-8 years, and then had the opportunity to move up to the Chisago Lakes Hospital, which was a precursor to Fairview Lakes, and worked there until Fairview Lakes was developed. And now for the last about 1.5 years, I've been involved with Northland as well. So work with a great team of people at both places, of people that are really patient focused, and make sure our patients get what they need in a safe manner.
Nice. So one of the questions that the kids always ask, and I try to get them to think a little bit deeper than this, but teenagers are teenagers, I guess. They always want to know, what a typical day is like for you. And an answer I get often is that there is no typical days in a lot of these health careers. So if you could, do your best to describe a typical day for you.
Yeah, I'll break it down into two parts, because not being a staff pharmacist, it's a little bit different than my director role. From a staff pharmacist standpoint, yeah, that falls into the no typical day situation, where the pharmacists are constantly assessing and taking care of patients, responding to physician requests, nursing questions, etc., and making sure that patients get the best drug therapy they can. We have hospitalized patients that we're taking care of all the time, and those patients are relatively stable from a day-to-day standpoint, although certainly they have emergency situations as well. But we spend a lot of time with patients that come into the emergency department, and that's anything you can think of that would come into an emergency department, and anything that can possibly happen, from sniffles and colds to very severe life-threatening situations. And so pharmacists get involved in that whole gamut of care that's necessary, and all the medications that are used in conjunction with that. And I oftentimes refer to pharmacy as being an information profession. Everybody thinks about the pill or the IV or the ampule or the injection or the insulin or whatever it might be, but we really deal with the information about those particular items so that we can provide the best information possible. We work with technicians, pharmacy technicians in our department, and the technicians do the bulk of the actual physical production of products for patients. And then pharmacists review those and send them to patients. But most of the pharmacists' time is actually spent on drug information and making sure that it gets done correctly. Myself as the director, I spend most of my time in meetings, unfortunately, but I'm trying to always work with the rest of the system, and we're always trying to evaluate the best method that we can to provide those services for our patients, not only from a safety standpoint, but an efficiency standpoint also. And then obviously working directly with the employees, working with staff to try and set them up to be as successful as they can be, to make their job an enriching job where they can really make sure that they're providing safe care for patients.
Yeah, I've talked to a handful of people, or we've talked to a handful of people with this class that are in a director role. And so I always appreciate that perspective, but I always try to ask these people, because usually they've had some kind of frontline experience, either, as a staff pharmacist in your case, or, I talked to a lot of nurses that have some frontline nursing experience. So if you could just kind of compare and contrast the life as a frontline healthcare worker to kind of behind the scenes as a director.
Yeah, and in a word, it would be acuity. I mean, the attention that the frontline worker has to have with the patient needs is it's just paramount. I mean, they have to be engaged and alert and awake and aware of everything going around them all the time. Using a story as an example, with a pharmacist, for example, if a patient comes in with a heart attack, they have a code blue, or what we refer to that. A pharmacist go and respond to that, and they help with that situation with the patient where the patient needs to be intubated and kept alive or attempted to keep alive with cardiac medications, respiratory medications, whatever else they might need in that situation. Obviously, a very stressful, engaging environment at that point, and making sure that the drugs we give are the right drugs for that patient and the right dose, etc. It's a very intense situation, to say the least. My job as the director, I'm just trying to build the systems available to make that as successful as we can for those people. So making sure that whatever drugs we need are going to be available at that time, and how do we arrange that system to make sure that they're there at the right time and available as they need to be. Yeah,
I would think that pharmacy in particular has a lot of technical skills and a lot of there's a ton of chemistry you would need to know. I would assume you probably took a whole bunch of those classes in college, and I'm glad you took those, not me. But we talk a lot about soft skills with these high school kids. So if the hard skills is all the chemistry that you're doing and all the hardwired knowledge you need to know, soft skills would be things like communication and teamwork and self-management. And actually what we did at Princeton High School is we partnered with a few area businesses to identify what they thought were the most important soft skills. And so our job is to implicitly, explicitly teach some of those skills in class. And so we talk about these 5 things often, and I'm just going to put them in the chat here so you don't have to memorize them. But there are things like communication, collaboration, teamwork, self-management, critical thinking, and accountability. So what I like to ask is if you could just give us an example of what these soft skills look like, sound like, feel like as a professional working in a health career.
Yeah, they're absolutely essential to the work we do every day. Communication, collaboration, teamwork, that's what we do. We have a program at Fairview that we've been adopting for the last year and a half now. It's called Safety Always. And it's an initiative that we have within our system in order to prevent patients from having bad outcomes. Bad outcomes can be everything from a wrong site surgery to a wrong diagnosis to a patient, or in our case, the wrong medication, wrong dose, whatever it might be that would cause a bad outcome. So one of the critical parts of our Safety Always is communication. We do things like, when I was referencing, for example, the heart attack condition in the emergency department, we don't have time to write everything down and keep track of it all as we would a formal order in our computer in that situation. So you're doing oral orders and verbal orders back and forth. And so an example would be a physician would say, I need etomidate for this patient. I need 16 milligrams of etomidate. And when we're doing that, when we're preparing that in that situation, when we hand that off, we're going to make sure that they understand that we drew up 16 milligrams of etomidate, not 60 milligrams, but 16 milligrams. So we do a lot of communication skills, a lot of training around how do we best communicate that information? How do we use teamwork? How does everybody know what their role is in that situation so that we can have a safe outcome for the patient?
Yeah, that's great. Is there anything else that comes to mind specifically that you guys have in place for some of these other skills like teamwork or self-management, critical thinking? Either, maybe you don't have something in place, but just things you notice either in yourself or other people?
Yeah, no, lots of things are in place along those same lines also with critical thinking and self-management. For example, our pharmacies are open 24 hours a day. We have somebody here 24 hours a day to help patients. I'm not here 24 hours a day to help our staff do the things correctly. So we've got pharmacists that work all night long here and making sure that they get done what needs to be done and they're available for these questions. So self-management's crucial for those people that we can trust them to be who they need to be in that instance. When we talk about critical occurrences that happen, it seems like they always happen more at night. All things from social things that are happening, social economic things to just plain physical maladies that occur. And so those people have to be really well on their toes, prepared to come to work, prepared to do the work they need to do for those patients. So it's extremely important that they're accountable for the work that they need to have done at those situations.
Yeah. So, as I think about things as we talk, I was just thinking about if you can kind of describe the type of person that might want to work those overnight shifts, because I know there's lots of opportunities specifically in healthcare. And could you talk about the kind of person or the personality you might have to be on some of those shifts?
Absolutely. And you'd cut out on me for just a second there, Eric, but I think I got the gist of your question. Yeah, people, and you're exactly right. There are people that want to work nights. They like the independence of that, the ability to do what you need to do at the time, to make their own decisions about things, to be able to respond on their own and have that responsibility. That's really what they like. Generally, I'll say this in a very general tone, a lot of times it's a different personality than most people have. I can say, however, in my instance, the people that work nights, both in pharmacies at both sites, are normal people. They're just like you and me. One of the things we afford them as a benefit for working nights in the pharmacy, and it's pretty standard in pharmacy everywhere, is that instead of working 80 hours over a 2-week period, you work 7 nights in a row, 7 10-hour nights in a row. So you work all your 70 hours in 1 week, and then the next week you're off. So we have pharmacists that travel that other week, that work alternate jobs, that do other things. So that's a big incentive for people to do that. We used to have a pharmacist that worked nights, and he had family that would always say to him, "Do you still work nights?" And he would say to them, "Do you still work every week?" So he had the bonus of that. But seriously, back to the people that like those shifts. It's people that are really self-starters, that really like to manage themselves and like to work in a controlled environment, that they are in complete control of what they are happening around them, at least as much as possible.
Yeah, I think that's good perspective. I like hearing that, and I think the kids want to hear that stuff too, because there might be, so that would have never been for me, but I know that I'm glad there's people out there, because I might need that care someday. So something that's kind of in the middle of my list of questions. This one usually takes a little bit of explaining, but the very first lesson that we did in class here, we watched or we talked about an old parable called "Who Moved My Cheese?" It's a book that's been around for a little while. Sometimes the people I talk to are familiar with it, sometimes they're not. But anyways, the concept has to do with change, right? So what I was trying to get these kids to think about is the obvious change in our learning conditions right now and how we're doing things. I didn't know what Zoom was 6 months ago, but I'm pretty familiar with it now. And the question I asked them is, what did you think high school was going to be like as an 8th grader, and what has it been like now? Because most of these kids are juniors and seniors, and they thought, oh, it was going to be so much. I thought it was going to be so much different, and it was going to be harder. And I thought, the building was going to be so big. And so that was the first change we talked about. And then we moved on to the obvious one with COVID. But what I like asking the people that we talked to is, can you think about any changes in your career? And you've been at it for a long time. I'm sure there's been lots of things that are different, but either changes in attitudes or changes in specific procedures, policies, rules. Could you kind of talk about that?
You bet. All of the above have had changes. I started pharmacy a long time ago, long before anybody was alive, probably before you were alive. And obviously our world has changed a bunch. I mean, obviously medicine as a whole has changed a whole lot. But, the basic obvious is that we didn't have computers in those days. It was all done on pencil and paper and that type of thing. And now everything we do is on a computer. We do very little pencil and paper anymore. So how we do our work has obviously changed a lot. A few principles have stayed the same. Patient safety has always been at the front of what we do. Our role is to make sure that when physicians order things, that it's the right thing for that patient and that it's done correctly. But when we talk more about what is being ordered, the medications, I would say from the medications I used when I first came into the profession until now, probably less than 2% of the medicines that we use now were available at that time. Everything's new. And when we talk about the therapies that we're using now, and for example, we use in our infusion area, our infusion therapy area, we have patients that come in for chemotherapy, for drugs to treat arthritis, all kinds of other diseases. None of those drugs were available even 15 years ago. Everything's evolving so fast that the new medications we're using are completely different in how we treat patients. We treat a lot of patients with Crohn's disease, arthritis, ulcerative colitis, those kinds of things with things that are called monoclonal antibodies. They weren't available even 10 years ago. It's how recent they are. And yet now probably 70% of our work there is with those particular medications. So as a pharmacist in the career progression, we've had to learn things that didn't exist when we went to school. So it's a constant learning pattern to try and keep up with everything that's new, all the new therapies, all the new treatments, new drug classes that are out that were never available before, and even targeted drug therapies that are specifically done for a specific patient, that a specific drug is made for that patient. It's amazing how much it's changed and how much we have, the work we need to do to keep up with those therapies.
I wrote down one of the first things you said. I just want to make sure I copied it down correctly. Less than 2% of the medicines you're using now were not available when you started. Is that what you said?
I would be a pretty good guess is about 2%.
That's unbelievable to me. And would you, is that related to just modern medicine moving forward, or is it related to the types of things you're treating, or both?
Mostly modern medicine. A lot of the treatments that we give today, a lot of the diseases we treat today weren't treatable at the time when I got into pharmacy. If you use rheumatoid arthritis as an example, and people have an inaccurate concept of what arthritis is. Rheumatoid arthritis is people that have disfigured joints that can't even walk because of their arthritis. It isn't just arthritic pain that all of us have, but it's people that their lives are really impeded by this disease. When I started in pharmacy, you used aspirin. That's what we had, was aspirin. And now we don't use aspirin at all in those patients. It's the therapies that we use, like we're mentioning, these monoclonal antibodies and others, they don't just treat the pain like the aspirin did. They actually change the disease progression. So we're making a tremendous impact on these people's lives. And also the progression of the disease, that it isn't debilitating for them. They can go out and live normal lives because of it. And there's tons of examples like that.
Just because it's on my mind a little bit, and I try to stay away from the pandemic conversation when I'm talking to all these healthcare people, but just out of curiosity, what's your perspective on the pandemic situation? And I know vaccine stuff is always a little controversial, and probably even more so in your world, but could you just discuss that for a second and what that's like from your perspective as the director of pharmacy?
Absolutely. my first perspective is it's a long ways from over. We got a long ways to go yet. For the last 4 months, I've been saying, well, we'll know a lot more a month from now. I still say that. We'll know a lot more from a month from now. And we've learned a ton. If you look at New York City and the percentage of people that got COVID that died there versus how many are dying today, it's unbelievable how far treatments have come. And that's without a vaccine, without really some really progressive treatments. It's been occasional drug here and there, but mostly finding out the right way to treat patients. From a respiratory therapy standpoint, the answer when people first came in on COVID was put them on a ventilator, try to keep them breathing. Now we know that people will do better if we try to delay the ventilator and not put them on it at all. And techniques like having the person laying on their stomach, it makes their lungs work better in that situation. So, I mean, things that don't necessarily have anything to do with great new treatments are greatly affecting how well we can treat COVID in our populations. The ultimate answer, well, there can only be two ultimate answers in my mind. One is the development of a good, safe, effective vaccine, which is very controversial when that will happen, how good it will be, et cetera. And the other one is that the disease runs its course. We're basically trying to do everything we can to keep the disease from running its course because we don't want to have more people die. We've already got a couple 100,000 people that have died in this country. If we wouldn't have done anything, we would have massive deaths immediately, and we might be almost through it by now, but the number of people that have died would have been in the millions, no doubt. We're trying to, as we learn better therapies, to prevent those occurrences from happening, and keep people as safe as we can. If we don't get an effective vaccine, it's going to be a matter of the disease running its course, and that's going to be years. It's going to be 2 to 3 years, probably something in that range. And when we first discovered the disease, somebody said that 70% of us are going to get it before it's all done. And if we don't have a vaccine, that's what's going to happen. Fortunately, most of us, at least certainly most of the younger population, aren't going to have terrible outcomes from that. But that's really the only two options for the disease, is to run its course and have all kinds of people get sick, hopefully not severely sick, or that we get a vaccine. So I don't know how much, I don't want to delay too far on this either, but if people have ever watched information on the 1918 flu epidemic, very similar situation to what we're doing now. And the difference is that we have the ability to treat patients so much better than we did back then.
Yeah, I don't want to get us down too much of a rabbit hole, because we could probably talk for the entire day on all this stuff, especially with how much you know. But I have been curious at how these two pandemics compare and contrast. And then the polio epidemic was another one that I've always kind of been curious to know, or to talk to somebody who knows more than I know about those things and how similar they are.
Yeah. I think polio's a different animal of sorts. I mean, it because of the type of disease and the fact that for about close to 60 years now, we've been able to prevent it and effectively prevent it. The difference between the influenza and the coronavirus vaccines is I don't think any of us expect a coronavirus COVID vaccine to be as effective as the polio vaccine is. That's really rare that you can have a vaccine as effective as the polio vaccine. But I think from the influenza, the 1918 flu, Spanish flu, if you want to refer to it as that, I think there's a ton of similarities. And many of the epidemiologists have been predicting that this is coming. It's just a matter of time. And now it's here, and we got to figure out the best way to handle it. I just think there's a ton of similarities between that. The biggest difference we have is two differences really. Number one is how fast we move around the world now, which allows the disease to spread very quickly. And secondly is the methods we have to treat it to prevent bad outcomes.
So that's a double-edged sword, right? Because the technology has allowed us to travel pretty darn freely, but the technology is also in place to help us, treat the disease a little bit better. That's that's quite the catch-22.
It is. You're exactly right. Yep.
So this has become my favorite question to ask, and it has to do with vocation. And I know I previewed this with you a little bit, but for a lot of these kids as a teenager, it's kind of the first time they're starting to explore what they're passionate about and things that are starting to come easy to them. I just talked to somebody who works in the lab at Fairview a week and a half ago, and she said her vocational journey started when she was in microbiology class, and it felt easy for her. And so I paused it and I said, can you guys, let's unpack that for a little bit, because there's not many people, including me, who would say microbiology came easy to them. So if you could kind of just describe your vocational journey and tell us about how you developed a passion and a feeling of purpose for the work that you do.
Yeah. Training obviously goes all the way back to grade school, high school, with the skills and whatnot that you learn. I think obviously people think of pharmacy and chemistry hand in hand, and obviously they're extremely closely related, and chemistry is extremely important. The one thing that has always kind of come easy for me and is extremely important, and it exists for all of us in the world of pharmacy, is math. Math is at the heart of what we do every day, and it's we have calculators, computers, everything else to do it, but you still have to always evaluate it in your mind and say, is that rational? And you have to have some math scope to be able to relate that and say, yeah, this makes sense for this dose makes sense for this patient, that it's rational, that it's reasonable. So math and chemistry are obviously at the heart of what we do and our work. But I think more importantly, once you learn that math and chemistry, then after you've got some of that as background and you start taking other classes in anatomy and physiology and figuring out how these chemicals affect our bodies to do what we want them to do. That's when I think it becomes really intriguing, is because that's why does the medicine make a difference? How does it affect your body to do that? And so the human body is really at the core of what we're doing, because that's what we're trying to modify to make better in all of our cases. So I think those skills are backgrounds that are necessary in order to really relate to how it's going to impact a patient on a day-to-day basis. I wasn't a big biology fan in high school, and as I got into more of the other things and how medicine relates to it, I find the human anatomy and physiology more interesting every day.
Yeah, I'll agree with you on that one. Anatomy and physiology was a tough course for me in college, but I really enjoyed it. I think the human body's fascinating, and I hear that from a lot of kids too that are in my health careers classes. They're starting to get into some of those anatomy and physiology courses, and those are the ones that they enjoy maybe a little bit more than those biology and chemistry classes. Yeah. I gotta stop bashing biology and chemistry because they were so hard for me.
Yeah, I mean, carving up a frog isn't quite the same as what we're dealing with on a day-to-day basis. And there's relationships there, but I certainly didn't enjoy that piece of biology when I was in school. So,
I like to ask about mentorship. So the question on my list says, can you tell us about somebody who's mentored you or somebody you've learned a lot from, either professionally or personally? Because I think that's definitely part of vocation and passion and purpose. But I had a conversation with a gal as part of this class, and she redirected me and said someone told her you should always have a mentor, a coach, and a corner person, or a hype man. So if you want to think about it like that, could you tell us about people who have mentored you or coached you or hyped you up?
Yeah, I could probably go back to my initial pharmacy career. I worked in at the Midway Hospital, like I mentioned before, and was my first job I ever had in a professional setting. Before that, I was a farm kid. I was used to going out and chasing cows and doing all those kinds of things. So to be able to have professionals to relate to was really an interesting position for me. My boss at that time was a guy that had been around pharmacy and was very innovative, always was willing to try new things. And probably most importantly, he was willing to share his learnings and his work with the staff. So when we had a new project to do or whatever else, he would engage one of us to help him with it. He wouldn't just do it himself and tell us about it, and he wouldn't just make us do it. He would work with us on it. And I think that was really important to have his guidance as you got started on those things. But more importantly, that it built you up as an individual to say that I'm capable of doing this. I can work with this. I have the ability to relate to the people like I need to in order to move it forward. He gave me the opportunity to present at different conferences and whatnot that I certainly wouldn't have had in many other situations. So the opportunity for somebody like that to really help guide you along and open the doors to show you what you can do was really helpful.
This question has a lot less depth, but I get some really good answers when I ask it. What's your dream job, either right now, besides your current position as director of pharmacy, or if you want to think about it, when you were in high school, what was your dream job?
Well, yeah, obviously at this stage of my career, it's be late to be switching careers and whatnot, or dreaming about other jobs. But I can go back to in my youth. When I was in high school, I thought I was going to be a math teacher. That's what I thought I would do because I always liked math. I enjoyed it. I thought it was interesting. When we're in school, we relate to teachers because that's who we work with every day. But I think it's important that we all figure out what else can be done with those skills and where else we can go to talking to other people, to meeting with other people. One of the people that I originally talked to before I went to pharmacy school was a guy that had recently gotten out of pharmacy school, and he kind of gave me the scope and perspective of what steps to take and to move forward, and it was just really helpful to be able to have that perspective that he had, and to guide me into the pharmacy world from what I perceived were my skills in other areas.
Could we dig a little bit deeper into that? When did you start to realize that you could take your skills in math and science and kind of turn them into this pharmacy career?
Yeah, I didn't probably do this the right way. Most of my cohorts, the people that I went to school with and early in pharmacy, they dug in and went to work for a pharmacy as an aide, as a whatever, just a clerk in a pharmacy, just to have some idea what happened there. Volunteering in the hospital, we've got volunteers, that are interested in coming into the pharmacy to learn more about what we do, and that's probably the right thing to do. I was more like dumb luck. I thought about pharmacy and thought about my skills and whatnot, and thought this is something I maybe should pursue. And then really, as I said, I had a conversation with somebody that had recently become a pharmacist, and he guided me down the path to say that, yeah, that I did have the skills that were helpful for that, and kind of how to get down the path of pharmacy school. It's interesting because I ran into this guy about a year and a half ago one day, and we got to chatting and talking about things and caught up with things, and I told him how important he was to my career, and he had no idea. It was a complete obvious. He doesn't remember our conversations or anything, and yet to me, it steered my career.
That's great. That's great that you caught up with him and told him that too.
Yeah.
This is, we're getting down there on our list of questions, so we've moved pretty quickly here, and that's all right. But this is a question that I always debate whether or not I should ask it, but I do think I've gotten some good perspective on it, and it's another kind of basic job interview question. But if you can think about where you see yourself in the future, either 1 year, 5 years, 10 years, and I feel like I got to tell people it's okay if they say that they are going to be in a similar spot than they are right now, because that probably relates back to vocation and doing what you're supposed to be doing.
Yeah. Well, frankly, I won't be in pharmacy 10 years from now. I know that I'm closer to retirement than that. But I can say more short term for that. There's always work to do in our departments in order to make them stronger, better, helping our staff learn more about the drug therapies that we need to work on. So, that's really a short term goal, is to help people kind of continue to enrich themselves. Make an environment so people can do that, so that we have the opportunity to continue to learn and grow with in their role. So that's probably what my short-term goal is, just to continue to foster those environments for people, for our staff. Otherwise, I would say 5 to 10 years, I'm going to be looking for something to do in retirement that I can still contribute. I probably won't be, I definitely won't be in a pharmacy director role, but there might be a part-time opportunity for me to do some pharmacy work, or maybe to do some consulting kind of thing where I can somehow assist others to get started, get moving, whether that be in schools or in some other type of an environment. That's probably what I'll be looking for.
Okay. So the last question on my list, before I wrap some things up here, if you could give these kids, they're all 16, 17, 18 years old. Some of them are legitimately interested in a career in healthcare right now, and some of them are on the fence and don't really have any idea what they want to do. If you were going to give them some career or educational advice, what would you tell them?
To relate specifically to pharmacy and respiratory, my number one school advice is take math. So you can't have too much math. And as we work further and further into more technology, the math behind the equipment that we use that makes it usable for us is paramount. That's just the number one thing I always tell people. Other than that, I mean, other advice I would say is to get out and feel free to shadow somebody. If you're thinking, maybe I want to be a doctor, you can contact our organizations and get hold of our PR people, and they can get you in line with a doctor to spend a day following them around to learn what they do, to see what it's about. And then the other thing is technology, the technological things. If we're looking at a health career, what I was looking at that many years ago is nothing like what you're looking at today. And there's going to be so many technological artificial intelligence kinds of things coming down the road that are going to be, it's going to blow out of the water what we do today even. And we think what we do today, we know what we do today is so different than it was 30 years ago. 10 years from now, it'll probably look just as different. It's just the changes are happening so fast. So obviously, aware of computer capacities and all those kinds of things, but also in the drug development side of things, it's going to be huge. How there's going to be targeted for certain patients and how specialized that's going to be.
Nice, that's great. Thanks for sharing that. So what I like to finish with is something kind of fun. They're these chat pack questions. They're kind of just like conversation starters, and sometimes I start with these actually, but this is a good way to wrap things up, and it's completely unrelated to healthcare or career advice or whatever. So this one might be fitting if you grew up on a farm, but it asks, if you did live on a farm, what would be your favorite thing about living on a farm?
Well, I guess I can only relate back to when I was there. The favorite thing was harvesting crops. A farmer, you're growing stuff all the time, and it's a high risk profession, and that never know if you're going to get rain or sun or anything else you need. So the fact that you can actually harvest stuff and see the fruits of your labors literally, that's pretty cool. That's where it's all about. Specifically, I loved to fill silo when I was a kid. I thought that was the coolest thing ever, the equipment you used and whatnot. So it probably goes back to my personality too. I like to have a sense of accomplishment, and that's the ultimate sense of accomplishment on the farm is when you're harvesting. Yeah,
I can relate to that a little bit. I grew up with a dad who's a farmer, so he's a crop farmer, and we had some hog barns, and I can't say I always enjoyed, power washing the hog barns and picking rock and all that stuff, but just to, make a connection to what we're doing here, the sense of vocation that those farmers feel when they, my dad always talked about he felt responsible for feeding the world, and when you can harvest that and you put in all those long hours and the hard work, it is a cool thing.
Absolutely. Yeah.
All right. Well, I'm going to stop recording here, Mark. So, I just want to say one more thank you and express some gratitude for joining us here. And, I'll be honest, I don't know a whole lot about healthcare, but I know about connecting people and chatting with people and finding people that do know a lot about healthcare. So, conversations like these with people like you is what makes this class great.
Great. No, and just to close my comments from a student perspective, if anybody's interested in shadowing from pharmacy or respiratory standpoint, get hold of us. We can't do it right now with the COVID world, but hopefully in the near future we'll be able to do that again. And we have students spend a half day with us just to kind of get a glimpse of what we do and get a better feel for, is that a possible fit for me? And there's no other way of knowing.
Yep, that's great. All right. Thanks a lot.
All right. Thank you.